Hello, everyone. My name is Cindy Reberg, and I am the Director of Communication at Wellness Coaches. And today I have the privilege of sitting with Krista Yoder Latortu at Wellness Coaches. She's our President of Provider Networks. Krista, can you give us a little brief intro about yourself before we get started today?
Sure. So my name is Krista Yoder Latortu. I am a licensed and credentialed registered dietitian with over 15 years of experience in the public health industry and employer wellness. I'm published in a number of peer-reviewed journals around those topics and have a master's of public health. I'm also a fellow of the Academy of Nutrition and Dietetics, where I serve on the board of directors for the Academy. As the president of Provider Networks, I oversee our national networks of providers, including our registered dietitians, our certified diabetes educators, and our board certified coaches.
So I want to dig a little bit deeper about diabetes and diabetes management throughout organizations or with employers. So before we get started, a lot of people are intimately involved with diabetes. I know it's very prevalent in the US, but can you give us a definition for those who are unfamiliar of what diabetes is?
Yeah, so diabetes is a chronic health condition that affects how the body really turns food into energy. So with diabetes, the body doesn't make enough insulin, or it can't use that insulin efficiently. This then leads to more blood glucose, or what we call sugar, in the bloodstream, and that over time can really damage the organs of the body.
So as an employer, a leader of an organization, why should I care about managing diabetes among my workforce?
So diabetes can cause serious health problems. We're talking heart disease, vision loss, kidney disease. So as an employer looking to support their workforce, looking to control healthcare costs, those are some pretty significant outcomes from diabetes. So diabetes really can lead to a lot of additional health challenges for an employee workforce.
Okay, so I think of two things when you say that. Not only is it higher claims costs, so very expensive for companies, but also from a productivity standpoint, it sounds like it's very, very expensive. Can you give us a rough idea of the impact of diabetes for U.S. businesses?
It is expensive. Like you said, diabetes is expensive for employers. For people with diabetes, the healthcare costs on an annual basis are more than double for those who do not have diabetes. And this is close to $17,000 annually for each person with diabetes. So we're talking a lot of money when somebody has diabetes versus somebody who does not.
Can you help explain what the recommended approach is for managing diabetes in the workplace? I'm assuming there's some sort of program that people are asked to follow.
Yeah, one of the interesting things about diabetes is that prior to diabetes, there's something called pre-diabetes. And this is for somebody who is at risk for developing diabetes. The reality is that pre-diabetes is pausable and reversible. So if we can catch employees when they have pre-diabetes and then intervene at that point or before, we can prevent a lot of our workforce from developing diabetes. Without intervention, 1 out of 3 people with pre-diabetes will develop diabetes. So we know that those costs double when somebody has diabetes. So it is really effective for an employer to have a tiered approach to how we address diabetes in the workforce. It can't just be helping our employees with diabetes. We also need to intervene when people have pre-diabetes and even before that, to prevent, manage, and treat diabetes. Otherwise, if we just focus on one segment of the population, we're going to be behind the ball and always trying to catch up, since the statistics show that people with prediabetes will develop those diabetes risk moving forward. So we really need to have this tier approach where you prevent, manage, and treat diabetes for an employee population.
It sounds like it's a pretty hands-on approach. This isn't all about just medication, especially in the prevention and the management stage. Um, so it sounds like it involves more things like education, lifestyle modification, and truly one-on-one close relationship and work with individuals, human beings, coaches, and registered dietitians. Can you talk a little bit about how Wellness Coaches partners with individuals at organizations to impact chronic health conditions, namely diabetes?
Yeah, so Wellness Coaches really takes that tiered approach seriously, which allows us to provide interventions and support to an entire employee population across the care continuum, whether that individual is in need of preventing diabetes or if they're in need of managing it or they need treatment. So specifically how we do that is we look at the employee population and we help people connect with the right providers for the targeted care that they need based off of their specific risk factors. And then they get a personalized approach to those interventions. So for people who are looking to prevent diabetes, they will get connected with our coaches, with our registered dietitians to get support around lifestyle modification, help with physical activity, nutrition, stress management, tobacco cessation, alcohol moderation, sleep. All of those pieces are going to be supported through the personal approach that each employee has and the relationship they build with their wellness coach and with their personal registered dietitian. Then for those who are needing to manage their pre-diabetes, so they don't have diabetes, but they do have pre-diabetes, they're at risk for developing diabetes, we have our CDC approved diabetes prevention program. That's a year-long program that's facilitated by one of our diabetes educators and offers support to a peer group who are struggling with pre-diabetes. So they're getting support from their peers and they're also getting that expert input from the diabetes educator. And then finally, for those with diabetes, they get personalized one-on-one consultations with their certified diabetes care and education specialists who give them diabetes self-management education and support. So they're getting one-on-one access to the diabetes expert to really support them in a personalized approach to treating their diabetes.
Okay, so thank you for that. Now, with regard to the people that Wellness Coaches puts into organizations to address some of these concerns, can you talk a little bit about the credentials of these individuals and then also help people understand what to watch out for? For example, there's nutritionists out there, there's trainers out there, etc. Can you give us some guidance on how to ensure we've got the right people in our organization working with our employees?
Yeah, that's really so important when you're implementing an employee wellness program to make sure you have the right providers who are the experts in the areas and in the programs that you're implementing. We know that when it comes to nutrition, it is the Wild West out there. There are so many different terms and titles that are thrown around. What we do know is that the term nutritionist is less regulated. So you might have somebody who has a PhD in nutrition and is a great resource, or it could end up being somebody who took a 1-week online course and is calling themselves a nutritionist. So there's just not a lot of regulation around that term. On the other hand, the term registered dietitian is a very tightly regulated title and is a national credential that is recognized by the Academy of Medicine to be the only profession out there licensed and credentialed to provide nutrition counseling. So when you're looking specifically at nutrition services for an employee population, you want to make sure you're only working with registered dietitians. One comparison I often hear is with accountants. All CPAs are accountants, but not all accountants are CPAs. Likewise, all registered dietitians are nutritionists, but not all nutritionists are registered dietitians. So you want to go with that tight credential, which is the registered dietitian.
That's a great point, and I like how you put that. That very much clarified it for me. Can we go one step further and talk about the qualifications of specialists with diabetes? I think you talked about a diabetes management and education specialist. Can you talk a little bit about what that is?
The national credential is the Certified Diabetes Education and Care Specialist, and or CDCES is the acronym. So CDCES, they are our diabetes experts who are qualified to support an individual with diabetes from medication management to eating around diabetes, exercising with diabetes, managing blood glucose levels, what to do when you have a high blood glucose, what to do when you have a low blood glucose, and really coordinating all that care and intervention for somebody with diabetes.
With regard to examples, any organization who's trying to bring on a program like this is going to want examples, case studies of how the impact was made. So it's very, very important to have positive positive outcomes. It's very important that we have positive outcomes to share as examples. Can you give some ideas or an example of how our coaches and registered dietitians from Wellness Coaches has moved the needle in an organization?
Absolutely. So I want to reiterate how each employee interacting with Wellness Coaches services is getting personalized support around their individual risk, whether that's prevention, management, treatment of chronic conditions. So I'd like to share just two stories quickly about somebody who has diabetes at one of the companies that we're working with. And so based off of that individual's risk factors, she gets access to not only a coach, a registered dietitian, and a diabetes educator. So really a whole support team around that person to help to treat the diabetes. So this person specifically had an A1C of 11%, which is very high, and that's a risk factor in that data that we would look at. And at the last meeting that she had with her registered dietitian, she was down to 6%, so a significant drop there. And then also she was determined by her physician that she didn't have to start any insulin or diabetes medication as a result. So because of the lifestyle modification that registered dietitian was able to support through nutrition counseling, and then also the regular exercise that the coach was able to encourage, the individual was able to avoid the medication, and she also shared that she's very happy and doesn't feel deprived at all. So not only is it an intervention that works for her health, it also works for her lifestyle and well-being as well.
Obviously, since COVID-19, many organizations are hybrid or 100% remote. Can you tell us a little bit about how these services are delivered? Obviously, we talked a lot about on-site at the workplace, but also virtually.
All of our services, once again, are going to be that personalized support to the individual and what they need. What providers do they need connected with? What services do they need for their specific risk? And then how do we make that service and those providers easy to access for those employees? So we do that through our Healthy Ways platform. And our Healthy Ways platform really amplifies the work of our expert providers, providing that proven service, and it's able to tailor the messaging to that individual's risk. As a result, the person gets their specific intervention that is personalized to them, and they're able to connect in a way that works best for them, whether that's having the provider on site to engage the employee population in a very proactive manner, or if it's virtually through HIPAA-compliant platforms that allow for that face-to-face interaction to happen virtually with their personal provider.
So let's pretend I am a leader of an organization and I am ready to get started. Where can I go to for more resources and information on how to implement a program like this?
So reach out to us. We would be happy to have one of our team members connect with you, learn more about the challenges that you're facing, and really help design a program and solution that works best for your employee population. You can reach us on wcusa.com to find out more information, additional resources, and how to connect with us.